How do you get rid of jowls? First, let's define what a jowl is. A jowl is tissue that's behind a fold that sort of sags down here. It's a sort of a euphemistic term. It doesn't have an exact definition. Now, it can come from a lot of things. It can come from sagging of the soft tissues. It can come from some of the individual's buccal fat, a fat pocket that's here that prolapses out and gives us more volume there. It can come from lax muscles. What's the best treatment for sagging jowls? So how we treat it depends on how much the individual has. In the smallest way, I have a young person who's got a little jowl, they're full in here, and their tissue is relatively tight. They have too much volume in here. What do I do with that? I do a buccal fat extraction. It's a beautiful procedure done under local anesthesia where we numb them inside the mouth and we make a little incision and we go right to the buccal fat. We spread a few times, we find that buccal fat pad, we let it prolapse into the mouth, we cauterize it and take it out, and then put a couple of dissolving sutures in. And in that subset of people, taking out the buccal fat without any lifting of tissues is great. However, many people, the jowl is associated with a little bit of fat and a little bit of sagging of tissue, sometimes a lot of sagging of tissue. And in those people, I prescribe some form of lifting. When we lift up the fat pads and we put them into a new position. As I like to tell patients, it's like an underwire bra, a lift for their facial fat. Now, here's the thing. All faces are different, and you have to have somebody that can do the right operation for the right patient. What's wonderful is when I do a traditional lift, a face, neck, and jowl lift that lifts everything up. It makes the jawline look better, it makes this fullness look better, and it makes them top heavy as opposed to bottom heavy. As we age, our face gets bottom heavy. We can look even hound doggy. And when we lift that up, we reverse that. We reverse the triangle. Instead of it looking like this, it looks like this. And that works great. But some patients just physically or financially are not ready for that. And so in those patients, I will often do something called a thread lift. It doesn't work as well, and it doesn't work for as long. It's sort of a temporizing thing. But some patients aren't ready for the big whammy, the bigger procedure. The bigger procedure is the best. It's the gold standard. However, thread lifts can help this. They reposition the soft tissues. They reposition the fat. And so what I like to do, the best treatment for sagging jowls really depends on the individual patient. We've got to look at them individually, see what they have, and then psychologically and financially see what they're ready for. And it's different for different people. What's ideal is if you've got a small treatment for a small problem, like in the 26-year-old who's got a little bit of excess fat here. This small procedure is great. However, if somebody's got a bigger issue and they want a small procedure, sometimes they don't match up. So we've got to watch that a little bit. What I like to do, I get the patient in my office, I tell them what it's going to treat and what it's not going to treat, and I let them make the decision. I want to be honest with them about what they have. So it's really important to go to somebody that has the full gamut of things. I'll occasionally, for a jowl, even use a little filler because the filler makes the marionette line looks better and it makes the jowl look a little better. So the things in our treatment, in our armor or quid, if we're an archer, are filler, buccal fat removal, thread lifting, and generalized lifting, a facelift. What I like to do is a deep plane facelift. If you have questions about this, call or email me anytime you want. I'd like to see you. I'd like to help you. I'd like to answer your questions. Thanks a lot.